Good afternoon and good evening to everyone. On behalf of Public Policy Projects, Genomics England, Wellcome Connecting Science and the Wellcome Sanger Institute, I would like to thank you for joining our webinar today on the very, very important topic of how to better engage with the public about the importance of genomics. My name is Kate Orvis and I'm a Senior Advisor to the PPP Policy Board with respect to our global genomics work. I'm also delighted to introduce Professor Anna Middleton of Wellcome Connecting Science and Vivienne Parry of Genomics England. We are really pleased to have such a diverse representation today from more than 30 jurisdictions, which to me really reinforces that what we are going to discuss is a highly important and very timely topic. And indeed, much of what we will discuss today will resonate with those of you who are looking at how to improve vaccine confidence, a point which was clearly drawn out at the recent G7 Vaccine Confidence Summit, which Vivienne chaired. The topic we're going to consider today is, in my mind, essential if we're to truly bring the benefits of genome sequencing to the world. Those of us on the webinar today are largely already engaged in the world of genomics in one form or another. And for those of us who are interested, there's a wealth of information at our disposal. And for me, a particular special mention, I think, to Genomics England's The G Word podcast, which I think is excellent, available to download wherever you get your podcasts. But as Anna and Vivienne are going to explain, we are not reaching everyone. And in a world full of misinformation, I believe there's a real risk that if we don't address this, the enormous potential benefits of genomics may not reach their full potential. I know from many discussions with many of you on this webinar that there are excellent examples of how people are trying to engage with the disengaged, but we need to do more and we need to do things differently. This work forms part of a wider focus of PPP on bringing the benefits of genome sequencing to the world, through which we have convened a global network of experts. And I'm delighted to see so many of you from that network here today. I would term that work the nuts and bolts of how to create an interconnected transnational data set. This work, however, is about how we engage the hearts and minds of our populations, which I'm sure we'll agree is essential. A few housekeeping rules before we start, if I may. Firstly, please ensure that you remain on mute unless you are specifically contributing to the discussion so that we can minimize background noise interference. Secondly, the presentation in this event will be made publicly available on the PPP website afterwards. The discussion that follows the presentations will take place under the Chatham House rule, which means that the content can be reported, but it will not be attributed. Thirdly, if you'd like to contribute to the discussion, please can I encourage you to do that through the chat function, and I will try to draw as many people in as possible from there. However, I'm sure you'll appreciate with there's so many contributors, I'm not going to be able to bring you all in. To reinforce the value of your contributions today, it has been identified that gathering insights has been an important point in encouraging vaccine confidence. And I would therefore like to issue this call to action to all of you. We need to gather as many insights from the global community with respect to public trust and engagement in genomics has been the case for vaccines. Each one of us has a part to play in this, whether that's sharing what has worked for you on a hyper-local basis at a national or indeed an international level. And we would love for you to share your insights with us, either through the chat function or by emailing your contributions to PPP. The details will be shared. And so, without wanting to steal Anna and Vivienne's thunder, I will now hand over to Anna and Vivienne. A small point to note is that to avoid any temperamental internet connections, Anna and Vivienne have pre-recorded their presentation, but I can reassure you they are both here and keen to engage with you through the chat function and the discussion that will follow. Anna, we look forward to hearing what you have to say.
Hello, my name is Anna Middleton and I'm a social scientist academic, and I'm going to be talking to you about the impact of genetics on people, on wider society. And I share this platform with my esteemed colleague Vivienne Parry from Genomics England, and would like to acknowledge also the input from Julian Borrer, founder of Thin Air Factory. So as you may be aware, genomics, genetics, genetic testing is now, it's here, it's mainstream. There are massive investments around the world into specific research programs, clinical programs, because genomic medicine, as we now know, has the benefit to humankind in terms of predicting, diagnosing, treating, managing, not just rare disease, but all disease. It has a part to play in all of medicine. And we know that when we talk about science more broadly, that this has the capacity to switch people off. So this is research from the British Science Association in King's College London, and this is likely to be have very similar findings to other countries, where we think that more than 3/4 of the British public, so that's 49 million people, are either not interested in science or will make no particular effort to engage in science. And so when we're talking about genetics and the benefits of genomic medicine particularly, there are whole sections of society that are very likely to actively disengage or switch off or think, this really isn't for me. And I'm going to share with you some research that we've done that really shows the evidence behind this. And I'd like to reassure those colleagues working in this space who are already working with patients or research participants that I'm not actually talking about them. So once people have engaged, then they're often very interested to learn more and to understand about the impact and effect for them. What I'm talking about is the audience who don't yet know why they need to care, who as soon as they see something on science or genetics, they actively choose to turn away. Okay, so why should we all care? Well, it really is relevant to all of us. And because genetic science and genetic research and clinical genetics has been around for quite a while now, and there are lots of patients around the world who have engaged with it, and lots of people who are taking part in research, there's enough of them out there, even though they are in the minority, their data is out there, that there's enough to connect all of us to each other. So even if you specifically have never had any level of genetic testing, never done an ancestry test, never done a 23andMe test, never had any testing in the NHS or in a healthcare setting or taken part in research, you will be distantly even related to somebody who has. And so the choices that they are making about the management of their data and their involvement with genetic science will be relevant to you. So it's actually now time for us as society to wake up and see that this is happening and feel that we can be part of the decision making around it. And I'm really talking to those people who are currently very disengaged, and we think that's the majority of the public. So another reason why you should care is because genomic medicine is here, it's now. So particularly in the NHS in the UK, and this is the same elsewhere around the world, you can get access to genetic testing in pretty much any clinic. So whether it's ENT, dermatology, fetal medicine, paediatrics, cancer care, genetic technology is there to help predict, diagnose, manage, personalise healthcare for you and your family and your relatives. And the way that genomic medicine works is through accessing data, large volumes of data. So that's represented by the crowd in the middle here. So if this little girl at the top here, her family are needing to find a diagnosis for her to understand what she's facing, we could take a sample of DNA from her, from a saliva or blood sample, and what the clinical scientists would do is compare that DNA to the DNA from thousands, hundreds of thousands of other people. And those people, their data exists in data sets, and those data sets bounce around the internet, crossing jurisdictions, crossing legal boundaries, shared between scientists and clinical scientists and researchers to try and understand where the differences and similarities are between this little girl and the DNA from other people. And the data sets have to contain data from young people, old people, different people of different ethnicities, different ethnic backgrounds, some people well, some people ill. And this is the way that we work out whether something unique found in this little girl is likely to play out in terms of her health or not. So it's via that comparison. And equally, we might be wanting to offer answers to this family, so this father and son, who are perhaps wanting to explore the inheritance of a condition in their family. Or we might want to be offering information to this man at the bottom here who is exploring taking antidepressants perhaps for the first time. And we want to know whether he can metabolize them or not. So to tailor-make particular medicines for him. So again, his data would be compared to large data sets from other people. So, as a social scientist, my group, and as part of the Global Alliance for Genomics and Health, wanted to explore what do people around the world think and know about what's happening within genomic research, and what they feel about large data sets from people being shared, and would they be willing to donate their own data? And this is a very large social sciences research study translated into 16 languages. And we have representative public audiences from 37,000 people from 22 different countries. Really just asking them, what do you know about this? What do you think about your data sharing? What are your fears? What are your concerns? What do you want from this? What do you understand by this? This is the largest social sciences study in the world done on public attitudes. And we've published a lot of this work already, but very broadly, what we found is that the vast majority of people across the world, of course, there's some variability between countries, but broadly speaking, outside of the USA, most people around the world are really unfamiliar with DNA genetics and genomics and what's happening within this space. They're also unwilling to donate their data to doctors and researchers and governments. They're most willing to donate their data to their own personal doctor, but they're more suspicious about donating their data to other people. And that trust in the whole data sharing endeavour is low. Trust in scientists, companies and governments using data is also low. And people are really unaware, mistrusting, unfamiliar, and want to know, why do you need my data? What's the benefit from this? So we need to do so much more to explain this and help people, come up to speed with this. And, for the last 20, 30 years, we've had, communications campaigns, we've had a lot of investment in public engagement and comms. And I think what we're realising now is that those strategies, whilst they're great and they're fantastic for people who are already engaged and have already voted with their feet to listen and to hear, they're not actually going to be reaching those audiences that actually actively turn away as soon as they see something about science. So we wanted to explore what's the language of genomics, what can we do, how can we communicate this better? And so we've been working with Ketchum and Maslansky and partners who have been helping us to do some new research, completely novel research on the language that we use around genetics. And what we wanted to do is to reach out to creative partners who are highly skilled at communicating with mass public audiences, to learn the best skills from them as to how they reach society with very simple messages about complex ideas. So Maslansky talk about the importance of really appreciating that it's not what you say, it's what they hear. So we can talk very passionately and genuinely about the benefits of genomic medicine and how we're enabling responsible data sharing. And we can say all of these things, but if people are not actually hearing it, then it's a waste of time. We need to figure out how to help people hear this and how to help them be part of this journey with us. So I'm not going to go into the specific details of the methods, but safe to say that as an academic researcher myself, I'm very impressed with the way Maslansky have approached this. So they look at the emotional resonance of words, so reading out text that we've given them with a particular participant audience, and online they look at the emotional response of our audience to the words that we're using. And we particularly wanted to reach out to British people of the following ancestry and background, so Pakistani, Black African, Caribbean, and also people of lower socioeconomic backgrounds, because we knew from our own research already that these particular groups were very disengaged from science. And so to start off with, and again, I'm not going to go through this in great detail, but we wanted to explore whether the word genome, genomics resonates, what people think about DNA, and whether the word genes resonates. And what we found broadly was that genomics, genome, DNA cause some confusion. They take people off at different tangents. Genomics, genome, people really haven't heard of. Genes they have heard of, and they relate this to ancestry, family, heritage. But more importantly, it raises fewer alarm bells for skeptical audiences. So that should be a framing that we should be using in our language. We wanted to explore, how do we explain the benefits of genomics? So do we want to use language that speaks to the collective benefit, the personal benefit, or the scientific benefit? And so we framed various texts and asked our audience to respond to it, to see how we could build a bridge to them and whether any of these methods were working for them. And we found that the messages around collective good really were not working for people. So when we said things like, the more of us who feel okay about allowing our DNA to be studied, the better healthcare will be for everyone. And what people were hearing was, well, the word everyone made me laugh. We're not included before, we won't be now. We don't want to be guinea pigs for everyone. There was a real sense of mistrust, distrust about this kind of rhetoric around genomics. We have to acknowledge, we have to be upfront, we have to really step out of our bubble in the genomics world and acknowledge that people have different histories, different perceptions of science, different relationships with health services, different fears about data hacking. This genomic data is part of the grid of data that's out there about us. And in the genomics world, we are very, very careful and cautious about how that's shared. But we can be as cautious and as careful and as honourable as we like. If people actually don't trust what we're doing and we're not communicating that well, then we're on to we're losing really the battle. So we really need to upgrade how we're talking and bring people with us on our journey so that everybody can benefit from this. So what we learned from the Maslansky work is that the baggage that people have is real. Historical injustice and lived experiences have led our audience to build a wall of distrust. And so starting a conversation anywhere else feels like we're ignoring the elephant in the room. And so we don't actually have permission to lead with the benefits. We need to think differently about how we're communicating about genomics if we're really going to be demonstrating why anybody should even care about this. And we also need to be thinking carefully about why we want to be doing this. And it's really about a partnership between genomics and humankind so that all of us can benefit, and also so that all of us can feel as if we have a stake in this and can be involved in policy around this, and more importantly, the governance around this. So this is the point where I'd like to hand over to Vivian to finish the rest of this presentation on how we might actually socialise genomics.
Hello. So you've heard from Anna that we are disconnected, us in the genomic space, from a large majority of the public. And you've seen from the work that she's presented on Your DNA, Your Say, that that's also the same in many other countries. So a very substantial proportion of the public don't trust. They're suspicious about our motives. And as you've seen, when we talk about benefits, we're simply not being heard. We need to bring people into the conversation, not to exclude them. And we need to socialise genomics. And by that, I mean, make genomics an everyday part of the conversation, something that you talk about in the pub without feeling self-conscious. We need to talk about the deal. That people call it the social contract, but essentially it's the deal between the public and the health system as far as genomics is concerned. Now, Genomics England has done a lot of work on this in the past, and you'll find the results of our public dialogue on social contract on our website. But essentially the public believe in three things: reciprocity, solidarity, and altruism. So there's a really deep felt opinions amongst the public. But there are certain red lines about genomics, about how it's used and what shouldn't be included. For instance, that it shouldn't be accessible to insurers for the setting of personal premiums. So we need people to be involved in those conversations about governance and to make sure that their voices are heard. And to do that, we need to get them to know more about genomics. And the other thing is that we need to be trustworthy, not to be trusted. That's something different. We need to be worthy of trust. Now, what would a scientist do? Now, I love a scientist, and faced with something like this and people not knowing about genomics, they'd say one of two things. One, the first is we must raise awareness, and the second is usually we must educate the public. But actually, we're clearly not doing a very good job of it because the knowledge of genomics is so low. And although the genomics profession are doing a fine job in getting high quality information and lots of it onto the internet, actually it's only available to those who are actually looking for it, and it usually requires a high level of literacy. And even with genomics and COVID making genomics part of the news bulletins and on every front page every single day for months and months and months, knowledge of genomics is still low. And where the clinical profession have involved particularly schemes that are for people in disadvantaged groups, actually they're all really small scale. Some of them are great, but they're just very small scale. So we need to do much more to scale up and to join up. And we asked Ms. Lansky, as you heard from Anna, what we should be doing. And the baggage is very real. People's lived experience makes them distrust. And if we don't acknowledge that past experience, then we will not be heard. And we also have to make sure that our language that we use is language that calms down concerns instead of elevating. And we have to acknowledge that skepticism right at the very beginning. Otherwise, if we don't do that, we simply don't have permission to lead with the benefit. But above all, I think we need to put power back in people's hands to make them feel that they're in control. And in fact, as you'll see from this quote, which was typical from the Ms. Lansky work, once we had explained things in terms of it's your choice, you can choose to be involved or not, then people were much more willing to listen to the benefits of genomics and actually were as enthusiastic or not as everyone else. So we need to find new ways of engaging with this disengaged public, because genomics is just not doing a good enough job at the moment. And frankly, we're right out of ideas. And the strange thing about genomics and not resonating with the public is that our genes are our identity. They're our family. They're our past. They're our future. Genes contains the human story in all its messiness. And no matter what we each look like on the outside, on the inside, our genes are remarkably similar, one human being to another. We need to tell the stories that our genes contain. Now, the people we want to reach don't look up to elites. They don't look up to professionals, and they don't look up to government, because they think they're the problem, not the solution. We need to take them to the places where they are. We need them to look down. to their screens, because that's where they hear stories. And the stories that genes contain are the stories that could be on their screens. There are many people here today who are from the creative industries, and no matter what genre of story they're telling, whether it's science fiction, whether it's manga, whether it's on a big screen or a small screen, whether it's a gaming console, these are the places that people are looking, and these are the places that are telling the big stories. And they're telling them not just to a few hundred, as we are able to reach in genomics, but to millions of people. And they're able to get straight to people's hearts, because I think this is not just about hearts and minds, but principally about hearts, because it's hearts that will resonate with these stories. And we know that films work. We did a little piece of work, Julian Borah, Anna Middleton and myself, on developing some films to socialize the genome. The content, I'm sure, could have been refined, but when we asked people whether it helped them to start conversations, overwhelmingly, the answer was yes, so they work. So to summarize what Anna and I have said, genomic medicine is not something special. It's going to be just medicine. And we need all to be part of this conversation, and nobody must be excluded. We can't let exclusion happen. But the broader public at the moment are unfamiliar, and they are also mistrusting. We now have the evidence that shows us that we need to communicate in different ways and far more creatively with much broader publics than we're able to address at the moment. So we need collective buy-in, we need collaboration, we need minds that think differently from ours to genuinely socialize genomics so that the whole of humankind can benefit. And I hope that we will now go on to discuss exactly how we might be able to do that.
Well, thank you so much, Anna and Vivian, for those excellent presentations.